So in regards to the medial aspect of the ankle, there's a few key structures that we want to identify and also to test. So just a few anatomical landmarks really, just to get you, to make you aware. So we've obviously got your sort of tibia that comes down into that distal tibia medial malleolar region. We've got your calcaneus that sits sort of posteriorly. On top of that, you've got your talus, and then you've also got your navicular that sits somewhere in between and slightly more distal to that talus. In terms of testing structures, we want to have a look at all the soft tissue. So the main ligament, the strongest ligament that you've probably got in your body, is the deltoid ligament. So it's made up of 4 different components. So we've got your anterior and your posterior tibiotalar aspect. So coming off that tibia and into the talus, you've got your tibio-navicular portion, and you've also got your tibiocalcaneal portion, and they'll all resist that nice eversion position. So as you drop into more eversion, particularly in a plantar flex position, they're going to become more important in that ankle stability position. So as we take them down into that position and open up the medial aspect, there will be increased tautness in these ligaments on the outside there. If that is an excessive movement, clearly we can get some abutting of that talus as it starts to glide into external rotation and move and translate laterally. So then you can get some impact onto that distal fibula. If that happens at force, clearly we can get some fractures distally, or if it happens as a repeated movement. So let's say there's some laxity on this side, what you may well find is that there's repeated trauma and you end up with spiral or oblique fractures higher up that fibula. The other structures just to be mindful of are the tendons. So we have the tibialis posterior, we have your flexor digitorum longus, and we have your flexor hallucis longus. So we're going into that sort of Tom, Dick and Harry mnemonic that gets used, or you can even go further with sort of Tom, Dick and very naughty Harry and include the arteries and veins and things. But just to familiarise yourself with those, so coming around the medial aspect of that malleolus, what we've got is your tibialis posterior initially, then we've got your flexor digitorum longus, and then we've got your flexor digitorum hallucis, so the one which supplies that big toe. So to test them, you would palpate accordingly along the line as you drop off that medial malleolus. If you wanted to increase the specificity, what you may want to do is cleverly just resist those different movements accordingly. So if you wanted to activate the hallucis, obviously bring in the big toe. If you wanted to get the arch working a bit more, that would then bring in the tibialis posterior more, and also that sort of inversion position that they're responsible for. So that's the medial tendons. Over the top of the medial tendons, what you've got is a flexor retinaculum, so a structure that almost envelops all of those tendons on that medial aspect. Again, they can be a source of pain as well. And the other thing that runs around that region is your tibial nerve. So as that tracks around here, what you can get is something called tarsal tunnel syndrome. And what you may want to do is a Tinnell's test, so we're just tapping directly onto that nerve in this position here, and what you may get is some pins and needles, some tingling, some other neural descriptors as well. And that's really the medial aspect of the ankle, of things that we typically see. Things, if we go a little bit more posteriorly, we have the retrocalcaneal bursa or the Achilles tendon. Coming further forwards, that sort of talar dome, potentially any sort of osteochondral issues, anterior impingements, things like that. So hopefully that gives you a good idea regarding the medial aspect of that ankle.